Hi, welcome to our telehealth video information series. I'm Garvin and this video is on Saflutan. So Saflutan belongs to a group of medicines called prostaglandin analogues. It is used to lower raised pressure in the eye and treat glaucoma. Glaucoma is a condition in which the pressure of fluid in the eye may be too high. So Saflutan is used for open-angle glaucoma, raised pressure in the eye or ocular hypertension. And how does Saflutan work? Saflutan eye drops contain the active ingredient Tafluprost, which is a type of a medicine called a prostaglandin analogue. It is used to lower pressure within the eyeball. The pressure within the eyeball is naturally maintained by a continuous flow of liquid called aqueous humor through the eyeball. Aqueous humor is produced by a part of the eye called the ciliary body. It drains out of the eyeball through channels called the trabecular network. If the outflow of aqueous humor is blocked, the aqueous humor builds up inside the eye, increasing the pressure within the eyeball. This pressure needs to be reduced, as it can damage the optic nerve and impair vision as a result. Tafluprost reduces the pressure in the eye by mimicking the action of a naturally occurring prostaglandin. Prostaglandins are a group of natural body chemicals found in many places in the body. In the eyes, they increase the drainage of aqueous humor out of the eyeball. Tafluprost is a synthetic prostaglandin that acts on the same receptors in the eye as the natural prostaglandins. It causes an increase in the drainage of aqueous humor out of the eyeball, which decreases the pressure within the eyeball. Tafluprost is used to lower raised pressure in the eye, for example in glaucoma. Saflutan eye drops are preservative-free, single-use vials of drops. So how do you use Saflutan? First, you wash your hands before using the eye drops. Take a single-use vial from the strip in the pouch. Replace any remaining single-use vials back into the pouch and fold the edges to close. Hold the vial upright and ensure that the solution is at the bottom of the vial before twisting off the top or the tab to open it. Tilt your head back and pull the lower eyelid down. Hold the vial close to the eye and gently squeeze the vial to allow one drop of solution to fall into the space between the lower eyelid and eyeball. Immediately after administering the eye drops, close the eye and press on the tear duct at the corner of the eye closest to your nose for about 1 minute. This is to minimize the amount of medicine that may be absorbed into the bloodstream, which will increase the local effect in the eye and minimize adverse effects elsewhere in the body. Wipe away any excess solution around the eyelid. Repeat this procedure in the other eye if your doctor has told you to use the drops in both eyes. The eye drops should be put into the affected eye once a day. The medicine is most effective if the drops are applied in the evening. One single-use vial of Saflutan drops should contain enough solution to treat both eyes if required. Once you have applied the drops, you should throw away the vial, even if some solution remains. Unopened pouches of Saflutan eye drops should be stored in a refrigerator at 2 to 8 degrees. Once a pouch containing 10 individual vials has been opened, it may be kept out of the fridge. Open pouches of the eye drops must be discarded 28 days after opening. It may be helpful to write the date of opening on the pouch in the space provided. So Saflutan is not to be used. This medicine is not recommended for children and adolescents under 18 years of age, as there is no information regarding its safety and efficacy in this age group. This medicine should not be used if you're allergic to any of its ingredients, so tell your doctor or pharmacist if you have previously experienced such an allergy. If you feel you've experienced an allergic reaction, stop using the medicine and inform your doctor or pharmacist immediately. So regarding pregnancy and breastfeeding, this medicine could be harmful to a developing baby. It should not be used during pregnancy unless considered essential by your doctor. Women who could get pregnant should use an effective method of contraception to to avoid getting pregnant while using these drops. So seek further medical advice from your doctor if this relates to you. It is not known if this medicine passes into breast milk after being applied into the eye. The manufacturer states it is not recommended for women who are breastfeeding. So if you're breastfeeding and being prescribed this, speak to your doctor for further advice. So the side effects of Saflutan. Common side effects would be red eye and eye pain and itching, irritation or discomfort, sensation of something in the eye, dry or watery eye, darkening, thickening and lengthening of the eyelashes, swelling, redness or itching of the eyelid, and darkening of the eyelid or skin around the eye, changing in colour of the iris, discharge from the eye, and dislike of light and blurred vision, and reduced visual acuity and headache. So the side effects I've mentioned may not include all the side effects reported by the manufacturer. For more information on any other risks or possible side effects, you need to read the information leaflet that comes with the medicine or speak to your doctor or pharmacist. How can this medicine affect other medicines? The manufacturer does not anticipate that these eye drops will affect any other medicine. However, if you're using more than one type of eye drop, you should administer them at least 5 minutes apart to prevent the second drop washing away the first, and you use eye gels or ointments last. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through the website mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or ring 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.